Egbona says many specialized healthcare institutions are operating under severe funding constraints, resulting in infrastructure gaps, manpower shortages, and inadequate medical equipment. He notes that the institutions, including orthopedic and psychiatric hospitals, obstetric fistula centers, eye and ear hospitals, and blood transfusion services, play a role in managing complex medical cases and serving vulnerable populations. The lawmaker assures that the committee will engage relevant authorities and the Committee on Appropriation to ensure fair and adequate budgetary allocations for specialized healthcare institutions.
Without their effective functioning, the health system cannot deliver optimal outcomes. However, it is evident that many of these specialist hospitals and institutions continue to operate under severe funding constraints. Annual budget provisions are often low and in most cases inadequate to address infrastructural deficits, manpower needs, equipment gaps, and expanding services demand. This largely directly affects service delivery and patient outcomes.
Before the committee is the medical director of the Federal Neuropsychiatric Hospital, Abeokuta, who expresses concern over the slow implementation of the Mental Health Act. He notes that the absence of a fully operational national mental health framework has hindered access to funding and partnerships for mental health care. Also, the medical director of the National Orthopedic Hospital, Enugu, states challenges faced by the health institution.
The funding is not enough. It's not enough, of course, and it's an issue that cut across the ministries, parastatals, and agencies in the country. But we want to employ that of course, we know that Nigeria is going through some economic reforms. There's always a period of pains before, light at the end of the tunnel. But we believe that 2026 the light will start appearing in 2026.
If you don't have CT scan or MRI, you may just as well be near Quackery. And most of these hospitals don't have CT scan and MRI. For instance, for over 50 years in Enugu, there is no MRI in the hospital. We'll be making efforts at public-private partnership, but the private people, they are reluctant.
The committee is, however, emphatic that improved financing for specialized hospitals is critical to strengthening Nigeria's healthcare system and ensuring better access to quality care for patients with complex medical needs nationwide. From the National Assembly, Henrietta Momodu, EBS News.